morning, everyone. It's nice having you join us on another episode of the Yaba Voice webinar. Thank you so very much for being on this call with us again today. It's a cool day here in Yaba. I don't know about you, but I hope you're feeling good and I hope you're doing so well. Remember, we care so much about your mental health, and that's why each month we roll out something good to ensure that you stay strong, productive, and alive, and then you're able to function and balance a whole lot of things. Today, we have something very important for you. We have key experts who are ready to roll out to you. But before we go into the conversation for today, the medical director is not on the ground with us today, but we have one of the arrowheads of the Yaba Voice, Dr. Stephen Oluwane. He is the head of clinical and also one of the members of the Yaba Voice. He's here on the ground to welcome us formally to this webinar. Over to you, Dr. Oluwane.
Oh, thank you so much, Dr. Akintoye. Good day, everyone. I want to welcome everyone to this day episode of Yaba Voice. On behalf of the Medical Director of Federal Neuropsychiatric Hospital Yaba, Lagos, Dr. Oweye, who is unavoidably absent. As you are aware, Yaba Voice is the platform of Federal Neuropsychiatric Hospital Yaba, through which we create awareness about mental health issues. We teach about mental health problem, how to prevent it, and how to handle it, all with the aim of an objective of ensuring that the mental health of our citizens is ensured and improved. Today, we are taking up a very important topic and a very relevant one, which is about drug abuse, a pandemic requiring urgent attention. I'm sure almost everyone on this platform today will know an individual who has a problem with drug misuse or drug abuse. And especially among the young people, it has become so rampant. And we know that this issue has or could have devastating consequences on an individual health. So that's the issue that we want to examine today, to look at what are the causes of this problem, what are the manifestations, and most importantly, what are the ways of preventing this issue. Those are the things that we want to look at today. Of course, again, we want to clarify some issues like terms that are used. Drug abuse, is it the same thing as drug addictions, or do they mean different things? When we talk about drug, what do we actually mean? I'm sure you've also heard about substance use disorder. What is the meaning of all this? But like I said, most importantly, we have a large population of our youths who are being affected by this problem. And this is our own effort to sensitize parents, teachers, community leaders on the best way to deal with this menace that is so rampant in our environment. To do justice to this, we have two eminent experts in the house. The first person is Dr. Olajumoke Koyejo, who is a psychiatrist, a fellow of West African College of Physicians, and a master trainer in Colombo, which is an international certification organization on drug abuse, substance use disorder. He has trained extensively in this area, and he has over 10 years of experience in managing this problem. More importantly, she's passionate about teaching on how to overcome this problem. So it doesn't get better than this, and I'm sure she's ready to do justice to this issue today. The second expert in the house is Mrs. Agboola, who is a fellow of West African College of Nursing, and she has a master's degree in addiction management, and she's also a master trainer in Colombo Universal Training Community. She's very passionate about advocacy, especially when it comes to drug misuse among the youth. So I want everyone to sit back and listen and be ready to ask questions as we take all these important subjects. Thank you.
Thank you so very much, Dr. Stephen Oluwaniyi, for that arousing welcome. And he had introduced the concept of the conversation to us today. We're going to be looking at drug abuse, drug addiction, and it's been a menace in our society. And one thing that I heard Dr. Luwani said was the fact that you would know someone that knows someone that has this issue. As a matter of fact, now I don't have any research or statistics to back this up, but it's like in every home now in this nation, in every family, there seems to be one problem with substance or the other. And that's why we're talking about this as a pandemic that needs urgent attention. By the time we're done with this conversation this afternoon, we will be able to understand what do we do? How do we move from here? Because that's very important to this conversation that we're having today. Now, the eminent expert has been introduced, and then we'll kickstart the conversation shortly. But please note that if you know somebody that needs to be here on this call, then please reach out to them. They can join us here live, or they can also go to our Facebook page, Yaba Voice, one word, and then they would also be able to follow us as we promote this conversation this afternoon. Thank you so much. Dr. Koyejo, you're welcome. And please let's know, when we're talking about drug abuse, drug addiction, what are we talking about? And let's look at the prevalence in our environment. Thank you, ma'am.
Thank you very much, Dr. Akitoyeshi. Thank you very much, the medical director, ably represented by the head of clinical services, Dr. Stephen Oluwaniyi. Thank you very much, and our audience at home and wherever you are. Good morning, good afternoon, good evening. Well, I would like to crave the indulgence of the medical director to allow me to take every one of us back to school, because that's how we learn addiction. So I'll start by taking all of us back to school and by defining what addiction is. Addiction is a chronic relapsing neuropsychological disorder characterized by recurrent, uncontrollable urge to perform an action. And this action can be the use of a substance or what you call drug, or a behavior that produces reward despite negative consequences. Whenever an habit becomes an obligation, addiction should be considered. Well, I talked about addiction as a behavior or consuming a drug of abuse or substance of abuse. These substances of abuse can be alcohol, tobacco, cannabis. Cannabis is what the Colorado, the weed, marijuana. It could be amphetamine or cocaine. Those are the drugs of abuse. While behavioral addiction can be those that are well established, like gambling, all those gambling, internet gambling, gambling as a whole. These are clear-cut ones that have been defined in the diagnosis book. However, others that are being considered that will probably be there in the nearest future, these are screen addiction. You could press your phone for several hours. That means computer gaming, television, chatting, and internet browsing, or media use. This would be another form of gambling. So like I said, it could be behavioral or substance. Then psychoactive substance. It's a drug of abuse or substance of abuse that affects the brain, how the brain works, and causes temporary change in the mood, perception, thoughts, feelings, or behavior. While substance use disorder is what you call addiction, or I call dependence, and it's a mental and behavioral disorder that develops as a result of the use of of predominantly one substance of abuse, which actually includes medication sometimes, which eventually leads to a chronic relapsing brain disorder and becomes the central point in the person's life. And with this, I think I've answered the questions Dr. Akintoye asked me. Back to you, ma'am. Or any other question for me?
All right, thank you, Dr. Koejo. All right, so what she had told us is, yes, sometimes people have habits and other things like that. But what we're talking about, when we're talking about addiction, is beyond habits. There is a compulsion to use, and it also has negative consequences on the user. So, and then sometimes you're also not able to stop. And then she had told us there are behavioral form of addiction as well as what we call the drug addiction in itself. And she mentioned some of those drugs or substances, as we would call them, of abuse that people tend to indulge in. Mrs. Agbola will be talking to us about the risk factors in people who have this issue. What are the risk factors? What makes an individual susceptible? Because mind you, Mrs. Agbola, I remember when we were much younger that we would smoke mats. I don't know why we didn't end up smoking. And then we smoke chalk too. No, we'll blow it, wrap it into paper, blow it. No, things that we saw inside movie. But maybe thank God we did not. But so what makes a person to be at risk of developing this problem? Over to you, ma'am.
Good afternoon, everyone. I want to say thank you to my medical director for the opportunity given to me to be part of this presentation for the month. I also want to appreciate the head of clinical seated to moderate the program, and to my able moderator, Dr. Akintoye. Thank you for the good job. Our technical officer, I appreciate you, Mr. Kayode. Yeah, I want to look at the factors, the risk factor of addiction. The truth is this: there's no one that starts use substance or any kind of substance that intend to be addicted. The aim is never to be addicted. But unfortunately, along the path, the individual got trapped. And what are these risk factors? It could be as a result of mental disorder. Someone who is having mental illness and is trying to help himself to be able to function. He may decide to try. Also, we have gateway drugs. What kind of drug an individual use would determine whether he or she will be addicted. There are a lot of substances that people are using, and along the line, they get trapped, especially heroin, marijuana. They never knew it would get them addicted. Another risk factor is hereditary. If an individual is having a parent or both parents that are addicted to substance, there's every likelihood that the individual will also become addicted, considering the gene in an individual. Also, early use. The earlier the individual enter into use, the chances of becoming addicted. Take, for instance, the brain gets fully matured at age 25. And where we have our teenagers from age 12, 15 to 20 using substance, there's every likelihood that the individual will get addicted along the way. Also, I'll be talking about unemployment. A lot of people are out there that are supposed to add to the economic value, but because they don't have any job, they don't have anything doing, the idleness exposes them to use of substance, which they never planned to get addicted to. Most of the time, these substances are being dashed to them by a friend or family member who is in use, and along the line, they got trapped. Trauma is another factor that could bring someone into an addiction. And that is why we are telling our parents to mind the way we treat our young adults these days. Anyone going through emotional trauma, sexual abuse, or any form of trauma, even loss of loved ones suddenly, could be considered as a trauma that the individual may not get out from easily. And in the course of going through this route of being traumatic, he or she may enter into use of substance and become addicted. The same thing with emotional problem. The way we handle things differs, and everyone needs to be resilient in life. A lot of people with little challenge of life, they become emotional, they are agitated, they are anxious, and by so doing, they find themselves in the use of substance, which get them finally addicted. Lack of cultural pride is another factor that could lead one into addiction. Families being respected in the past, oh, once they ask you, who are you? Your family name is so precious that you want to protect. But these days, our youth does not have regards for their family pride any longer. They do anything they like, they go into use of substance, and at the end of the day, they get addicted. Neglect is another vital factor that get people addicted. When an individual is neglected, especially our children, they are uncared for and they felt lonely. Once they find any opportunity or a shoulder to lean on, they don't care whether the person is going to introduce them to any kind of attitude or behavior that can be detrimental to their lives at the end of the day. So an individual going through episode of neglect may likely become addicted. And that will also take us to peer influence. Our young adults, they don't have that strength to stand alone. So they need someone. And once they come to that junction and someone is telling them, have this, you'll be fine, just take this, you'll be cool. They are not, to question what is the consequences of the action they're about taking. All they know is that somebody is scared, somebody is there, and whatever the offer the person gives, they take. And at the end of the day, they have themselves been trapped into this menace called addiction. Thank you, Dr. Akintoyoshe.
No, as she was talking about all of this, a lot of questions were going on in my mind, and one of them is, how do we get out of these in the first place? Because the risk factors are so germane. Now, for a lot of us, we were backlashed. Some of us were even beaten with Oroba. There were a whole lot of things like that. I don't know, the factors are just too many. Now, looking at the current rate of unemployment in the country and the financial difficulties and challenges, how do we get out? But before we get there, I'm going to share with us some of the signs of addiction, because now most times people will say, oh, it's just an habit. I'm just taking it. I'm not addicted. How do you know that this is a problem? This is an addiction and you need help dealing with it?
Thank you very much, Dr. Akintoyeshi. And thank you very much, Mrs. Agbola. Well, to talk about how people get to know what is happening, maybe I should even share with our audience the prevalence of substance use. That means how common is this thing? How widespread is this menace of substance use? Well, the United Nations Office on Drug and Crime in 2018 published a study that was done nationwide in Nigeria amongst people between age 15 to 65 years. And they realized that 14.4% of Nigerians between this age group have used one substance or the other in the past 12 months. May I tell our audience that this is 3 times the world's prevalence of substance use among people of that same age group. Also, substance use is highest among people between the age 25 and 30 years, and it is greater in the South when you compare it to the North. 25% of substances of abuse are used by females. And Lagos State has the highest prevalence. I'm not proud of this at all. A prevalence of 33%, which is followed by Oyo State that has a prevalence of 23%. Another thing I would like to tell you about is that despite even this high prevalence, some states have been termed difficulty, that people have difficulty in assessing treatment. And in the Southwest, Lagos State has been termed to be amongst those states that there's so much difficulty in assessing treatment. Bayelsa State is termed is one of those states. And now, with this high prevalence now, let me now go to the early signs of substance use, because before we make diagnosis, let's even educate our audience on the day-to-day things that they will see in their children or in people around them that they should suspect. I did not say diagnosis. To suspect substance use in these people. Undue mood changes. Seeing a young person just temper flares, undue irritability, being unduly defensive. When there's unexplainable academic drop in academics, academic score, please check more. This person is changing friends and is reluctant to have parents know this new set of friends. This person is now avoiding eye contact, ignoring or breaking curfews, acting irresponsibly, frequently asking for money. I'm sure we've all experienced people that will say, quick 2,000, 2K there, quick 3,000 naira there. Can you just give me? Those people like that, which they should please suspect, they should suspect something. People are now locking their bedroom doors. They're making secretive calls, isolated from themselves, from their families, making excuses or outrightly lying, withdraw from classroom, resisting discipline or feedback, loss of interest in hobbies and things that are previously pleasurable. You can imagine a Man U fan, what do you call it? The blue fan, what do you call them? The Chelsea fan, and someone that has so much interest in football, now not even believing those things again, abandoning long-time friends. Please, let's suspect there might be drug use. Like Mrs. Owolola said, nobody planned to get addicted, but Olani Agbola said, nobody plans to get addicted, but they find themselves there. So what are the things that would happen in someone that you would think there is dependence or addiction? Uncontrollable urge. Once someone starts having uncontrollable urge to take a substance or the other, please start thinking of dependence or addiction. Once you have to increase the amount you were using before, if you were taking like 1 wrap before and you have to take 2, 3 now, or you are changing from the normal beer to spirits, then think of addiction, neglect of other forms of pleasure, continued use despite harm. When you can't even control when to start or when to stop again, then think of addiction. Another way to know that this person is addicted is when you start having withdrawal symptoms, hangover. What my patient will tell me, the cure for hangover is to take more. Think addiction when you start having this. And these are, once you have this in a period, any 3 or 4 of this in a period of 12 calendar months, then there might be addiction. There's need to access care or seek professional help to totally know what is happening. I think I've answered the questions that Dr. Akintoye asked me. Let me hand over back to her. Thank you very much.
Thank you so very much, Dr. Koyejo, for that wonderful response. And that's to look at the size of addiction. I know one of the things that she had told us is it's like it's a progression from our conversation today. It's like a progression. So it moves from, yes, I want to use, you're not able to control the urge and other things like that, then to the point where you are not even totally not able to now do without it. Becomes like life to you, breath to you. And so each time you want to just keep using and using and using. And then even when you now want to try to stop, then you find it very difficult to stop. These are cardinal signs that would help you to know. And one thing she just said is this urgent 2K. Sometimes the urgent 2K is not for food, though. So you must be mindful of who you are responding to. What are they doing with the urgent 2K? Now, it's very common now. People say, can I see 2K there? Now, you look like it and it's like a small money. No, small money now. Let me just give the person. But they might be using it for substance, especially for somebody who doesn't even have that kind of habit before of asking. But because they need to satisfy their urge, they keep asking and asking to be able to meet up with the demand of using the substance. So these are things that we need to begin to watch out for. A whole lot of times you find out that people will tell you look out for them, then we would find out that it's really there, and then we need to be able to deal with it. Now, Mrs. Agbola is going to talk to us on this substance problem. It's now becoming something prevalent everywhere. And one of the things Dr. Korejo earlier stated was the fact that it's even highest in Lagos, Nigeria, maybe Rivers and some other town. And access to treatment is even still poor. Now you see them virtually everywhere, and they don't even understand that. Oh, somebody just said they even ask as low as 200 naira. Yes, and even right there on the street, now you're walking, they will just say, give me money for pure water and other things like that. But the truth is, it's not for pure water. They're using it for something else. Mrs. Agbola is going to talk up to us about what are the maintenance of substance addiction. If we're looking at this, what's the implication? Because we need to understand why we are talking about this to be able to get help to deal with it. Over to you, ma'am.
Thank you, Dr. Akintoyeshi. This menace called addiction, it is unfortunate that the users never knew that it has a negative impact on their lives at the later on. The menace has a great negative impact on the individual, the family, and community at large. Looking at the menace on the individual, if an individual is a student for that matter, this menace can stop him or her from progressing academically. You will see the individual skipping classes, avoiding assignments, not sitting for examination, and the parents may not even know. They believe their children are in school. They keep sending money for school fees, for accommodation, for feeding. Meanwhile, the individual is no longer attending class. This is a negative impact on him. And if the individual is able to skate through school and is not working, the addiction will have taken over the entire living of the individual. Those are the people you will discover that he earns so much, but he has no savings. They will have used all their money they are earning on substances. And it will progress to the point that individual will become, inability to work or to perform at his or her duty post any longer, which can lead to termination of job and employment setting. The individual can also be a married woman or man. This menace can bring the partner to run away, to separate from him, or to divorce with him or her completely. This menace could lead from having a house of his own or living in a family house to the point that he will become homeless. We've seen cases of people selling their family property to do these substances. And at the end of the day, they will become homeless. And they will not be the only one suffering from this accommodation problem. Sometimes the buyer of the property will just come to eject the parents who were once owner of the house. That is a very negative impact on the family. The family are also interested in this, their child, their only son, their only daughter, their only child, their wards, their niece, their nephew. And they are like, let's seek help for the individual. He may not be willing. And if peradventure involuntary treatment is sorted, the individual may come in and not be willing to quit. considering the fact that the family have to run around to raise money for the treatment. And currently, there is no hospital treatment that comes cheaper any longer. Everybody can testify the cost of medication, even at the pharmacy stores. Talk less of bringing somebody in for rehabilitation. So the family have to suffer financial losses, haven't lost some of their property to the individual as a result of, pick and sell of certain items from the house. They still have to look for money for rehabilitation. It's not friendly on the relation at all. The health of the individual will also suffer. Substance use could make the individual to contract all sorts of communicable diseases, HIV, hepatitis, tuberculosis, and others. They can suffer organ damages like liver diseases, renal problem, lung problems as a result of use of this substance. I need us to know that the menace of addiction is bigger, too numerous than the pleasure that the individual will enjoy in the use. And that is why Yaba Voice is coming out to tell everyone that we need to guide our words. And to the parents that are using, we need to look around us and look at our children, consider the implication on them later in life. It may not be now. And another menace is behavioral disorder associated with this use. A child that a parent will call once and he will respond with all humility. If you are not careful, we've seen cases of children slapping their parents, some even hurting them, we've seen cases of killing parents because they are trying to stop him or her from use. All of these are terrible menace of addiction. And as we've been saying, we can say it is not his fault, he never intended to be addicted. But here is addiction. It is a chronic relapsing brain diseases. Looking at that definition as said by Dr. Koyejo, is enough reason for anyone to run away from it. Because once your brain is diseased, almost everything about the individual is sick. You'll not be able to reason well. You'll not be able to coordinate yourself, your life, and things around you. The individual will not be able to take decisive decision. Judgments will become, poor and what have you. So the menace of addiction is numerous, is uncountable compared to the pleasure that the individual will enjoy at the time of use. At this point, let me hand over to Dr. Akintoye.
Thank you so very much, Mrs. Agbola, for that. I saw Justina Coley said, And honestly, at the time you were doing the own thing, I was also doing the own thing in my mind too, because you could understand this menace that we're talking about. There was this young man who went to the university. Supposedly, he was studying medicine and surgery in one of the schools in the South. And every year he would come back home, collect money, go and register. And at the end of the 6 years thereabouts, or 7 years because of strike and also, they were expecting come results. And there was now like a blah, blah, it was, and so on. And then before they now knew that by 200 every year started using substance. And one thing about substances, it takes away pleasurable interest. It takes away your interest even in the things that you should focus on. And so there's lots of concentration and attention on the very important thing. And this boy wasn't going to classes again. But yet he was collecting money and he was using it to smoke and do a whole lot of things. Now, that's it. And I was listening to people who 4 years, they will have changed department from biochemistry, they will go to chemistry, then they will go to the bio after that one, they'll go to Yoruba, do CRS, and then at the end of the day also, they are not even able to come out with anything. And that's the challenge. It's so huge. Now look at the one Ms. Agbola talked about the fact that we had history when a child will kill the parent all because they are trying to restrain him from using the substance. And it's as bad as that. At that point in time, someone will say, they didn't know what they were doing. But that's a menace. And so if we do not talk about it, then we keep having incidences like this, which would keep escalating and causing so much problem in our environment. And that's why we're talking about it. Because if we do not, then this problem stands to about. But if we understand that there is a problem, then we would all stand up to address it and address it appropriately. Now, Dr. Koyejo is going to talk to us about how do we deal with this menace. It's a long list. I don't even know where to start from. But how do we deal with this menace, and what are the protective factors that we have around us? Please note, keep your questions and your comments coming. We would address them before we close this webinar. Thank you so much.
Thank you very much, Dr. Akintoye. And I believe our audience, they are learning so much, and it's a topical issue that we cannot overemphasize. But let me start from protective factors. An human being lives in the environment, and when it is not available, you do not use. So let's start with environmental manipulation. How do we, if there's no demand, there will be no supply. Let us categorize the environment to the macro environment and micro environment. The macro environment, these are the environment around us, and of course, our own personal characteristics. So we have three categories now: the macro, the micro, and our personal characteristics. These are factors that determine whether we will use or will not use. So what's the component of the macro environment? I keep telling us that I'm taking everybody back to school today. We're going to become addiction experts. The macro environment includes government policies. What policies are government churning out to protect the citizenry? Sometimes, about some few months ago, talked about, they said the government stopped sachet alcoholic drinks, and the House of Representatives said no. Stopping it is the way to go. But because when it is available, accessible, it's so cheap, everybody can buy it, the use, initiating and continued use is encouraged. Policies, what policies about taxation? The tobacco company should be taxed to the sky. Let it not be available available or accessible. These are part of the macro environment. What about culture? There are some aspects of our culture that should not be encouraged, and there are some aspects that should be encouraged. If Dr. Akintoye should ask me, Dr. Koyejo, when was the first time that have I ever taken alcohol in my lifetime? I'll probably tell you yes, because on the 8th day of my life, alcohol was used to name me Olajumoke. Can't believe it. That's part of my culture, the Yoruba woman. Shinap is used as part of our naming ceremony. How about economy? Poverty could lead people to use. So these are the macro economy, the macro environment that can be manipulated to prevent even starting at all. Then the micro environment, family, immediate family. What are family members doing to either help increase or reduce use? I keep telling people that when I pray this prayer that our children will be more than us, in Yoruba, they will tell you that I'm telling some parents not to say yes to that prayer, because even with alcohol use, your children will do more than you. So please don't say yes to those children. When you have that great bar in your house that you think you are using as a status, you are directly or verbal and non-verbal language communicating to your children that important people always take this. So, and the child feels I'm an important person too. So it goes there to use it. What happens? The micro environment. What type of people are we keeping as peers? In addition, we tell them people, places, activities, and things. People you keep as peers. How do they affect your substance use? School. What happens in the school? Faith-based organizations. How do we encourage or discourage substance use, drug abuse? And even in the workplaces, how do we encourage or discourage substance use? Let me talk about personal characteristics. Some people are at risk of using their temperament, their physiology as a way of either encouraging or discouraging. Let me talk more about the family, how the family contributes to substance use. lack of involvement and monitoring. Do we involve ourselves in things that our children, what they are doing? Harsh abusive and neglectful parenting. You're always saying you don't know how to do it. There are no times that you encourage them. Are we negative role models to our children? Stress or chaotic environments. Parental substance use are ways in which families have contributed to substance use in our environment. So there's also the issue of high expressed emotions, critical comments, hostility, emotional over-involvement. Nowadays, we feel that we are protecting our children and we don't even allow them to face challenges that are age appropriate at all. We are so involved and the rest like that. These are things that could one way or the other lead to substance use. Then let me talk about in schools. There's a life skill training. This is a 30-year evidence-based type of skills that should be incorporated into schools. And what do you teach them? You teach children from age 4, because that's when they start using that gets introduced substance use. Self-esteem building, decision-making skills, communication skills, social skills, assertiveness training, coping skills. These are things our children should be taught. And these are ways, these are protective factors and the factor that we could manipulate in the environment to help our children not to go into substance use. Thank you very much. I'm sure you are writing your questions now. Allow me to hand over to Dr. Akintoye to continue with moderation. Thank you very much.
Thank you so very much, Dr. Korejo. So it means everybody has their role to play. The government has a role to play. Culturally, we must become more sensitive. So the things that we do, in giving a child, a baby, alcohol, and say, Olajumoke is your name from today, you now begin to wonder, what's the correlation? But some of those things has a tendency of enhance. Now, I was in the market one day and I saw a mother, the baby, the child would not just be about maybe a year plus, and she was giving beer. And I said, wow, I didn't even know when I reacted. I said, he hasn't started. This is not the first time. He's been drinking it. And I was like, hey, now this is, I don't know where the child will be. I don't know how the child will be faring now, but these are things that we need to begin to look at. Yes, bars in the house, it looks like a prestige thing. It looks like an affluence thing. But when you're not there, how do you ensure that your children don't even use it, when you're not there? How do you ensure some of those things? Some of the patients that we had seen, most times they would tell you, it's from my father's bar. That's where it started from. They would take a bit of it and just zip. For people who send their children to buy, when you ask them to return the bottle, they will zip it. People who send to buy cigarettes, when you finish and throw it down, they will take it and continue. A lot of all of those things are there. And these are things that we need to begin to look at. But then Mrs. Agbola is going to tell us available treatment. Now, for all that we have talked about, what are the available treatments? Is there still hope? Is there still something that we can do? Over to you, Ma.
Thank you very much, Dr. Akintoye. When we are talking about treatments of addiction, the truth is there's no single treatment that can handle addiction. There are a whole lot of programs to manage addiction. And first and foremost, is the individual willing to be treated? Are the parents, the family members, the significant others, are they willing to support the individual? The community where the individual resides, are they actually interested in him getting better and productive? There are a lot of treatment, like I said, starting from screening. Like I do tell people, save yourself the pain of tomorrow with 10,000, 20,000, 50,000. Let every one of us rise up to screen our children. That trusted boy, that lovely girl that you trust so much, why don't you go out of your way to screen him so that you can be at rest, at peace of mind when you discover that, oh, the result is out and he or she is negative. rather than waiting till when the problem will now become help us, calling neighbors, looking for vehicle to move the person from your community to facility where he or she will be attended to. And part of treatment is assessment. Having screened an individual, and if he or she is positive, she needs to be assessed. And the assessment can only be done by the professionals. And who are these professionals? We can get a whole lot of us at Federal Neuropsychiatric Hospital, Yaba. Assessment will determine what kind of things can be done from this person. And the first thing for treatment of addiction is called detoxification. And I need us to know that detoxification is not treatment. Like some people will come to say, he claimed he is no longer using. I think he's fine now. No, it goes beyond there. And detoxification cannot be done at home successfully because detoxification takes a whole lot of processes. It is during the time of detoxification that individual will experience all the withdrawal syndrome, like muscle pain, restlessness, stooling, running nose, inability to sleep, pacing up and down. And because he cannot cope, he knows that if he should have that substance, immediately all those withdrawal syndrome will vanish. So detoxification is best done with assistance of medical personnel. And that is the reason we are calling that you can bring them in. The period of detoxification is when the individual is taken out of the use of the substance being used, and the one used have to get off the system. And during these processes, there are a lot of needs to be done. Some may become so dehydrated that they need to be rehydrated. Some will lose their appetite that the professionals will have a way of, talking the person into eating and getting strength again. Part of the process, when the individual is no longer sleeping, there are certain medication that can be given to restore the sleeping pattern. A whole lot of things that detoxification requires in the life of the individual. And haven't assessed the individual, we now plan the treatments. One of the treatments is what we do at Federal Neuropsychiatric Hospital, Yaba. That is in-house rehabilitation. When the individual comes, different teams will come in with their support, starting from the consultant psychiatrist and the team, the nurses, the psychologists, occupational therapists. Everyone will keep their hands on deck to ensure the restoration of the individual back to life and to productivity. A lot of patients who comes in for rehabilitation, once they have support from their relatives, they go back to the society to influence their community positively. A lot of people in the course of going through the treatments, they must have lost their job, especially those that are working with private sectors, and the organization can no longer keep their post. So they are out of job. During the rehabilitation, they learn a lot of skills that can take them back to the community to be productive. Many of them will learn Kampala making, bead making, barbing, computer operation, and what have you during their rehabilitation process. And when they are back on their feet, as part of treatment, is the way the community is going to receive them. Oh, once upon a time, he was a banker. Now he lost his job as a result of use. He has learned how to make beads. He has started small-scale business within the community. Are the community ready to patronize him or her? Are the community not criticizing, not stigmatizing? Are they not cautioning people that, don't move to her, don't give him job? No, you've forgotten, he was taken to rehabilitation center. And all of this will not encourage treatments. And for those that are having substance use disorder with mental disorder, I need us to know that once they have mental disorder as comorbid, they must be on their treatments, even after discharge. So let us endeavor to give them that support to that end, that this person needs to go back to see the doctor, he needs to go back for checkup, he needs to continue to have his medication. A lot of our patients, once they return, we ask them, what is happening? They will tell you, my dad refused to give me money to come for follow-up. My mom is not willing to support me anymore. My wife is doing this. My husband is doing that. And I have no choice than to go back to my friends. All of this will not help treatment. So treatment requires the individual, the family, and the community. Thank you for listening.
Thank you so very much. Usually 1 hour is the time we have for Yaba Voice webinar, and we are running out of time. We have two major questions on the platform. Dr. Koyejo is still to talk to us. Yes, I can see the end for the people who wants to talk. We don't allow people to talk on the Yaba Voice webinar, but please, you can send your comments. I would take it. Please send your comments. I will take it. I had seen the comments you sent, Maureen, on Precision, and I'm sure that maybe if you joined earlier, Mrs. Agbola actually talked about that, but then she would also talk about it again. Yes, thank you so very much for everyone who had one or two things to say, but we don't allow people to talk. But you can leave your comments, and then we would read it, and then everybody would benefit from this. Even if we're not able to read it, you can always check the response on the chat box. So Dr. Koyejo is to talk to us quickly. What's that? The predictor. Somebody asked a question about what are the predictor of substance use. Can you just take that in 1 minute?
Thank you very much, Dr. Akintoyeshi. Mrs. Ben Olani Agbola has spoken so much about this. And let me talk about risk factors. Let's call it risk factors for substance use. And let's start with the person. Genetics. People have family history of substance use, grandfather, father. And that means there's a genetic predisposition to one substance or the other. How about people's personality? Fun-loving people, they just want to seek new things. And in their bid to seek new things, to just try novel seeking, these are factors that would predict substance use in such persons. Let's talk about the immediate environment now, the family. Parents being role models to their children, availability, accessibility, and affordability. These are factors these are risk factors that could help predict if somebody would use or not. However, having one of these factors is not equal to use, and there's several other things that we considered, but because of time, I would like to hand over back to Dr. Akintoyeshi. Thank you very much.
She had talked to us. There are lots of risk factors, genetics, and quite a whole lot, environment, accessibility, affordability, and all of those things. Peer pressure, those are some of the things that have been highlighted earlier. But quickly, Mrs. Agbola, substance use because of somebody has a trauma, health challenges, a sickle cell patient using, how does that correlate? Just quickly in one word, please.
Much, Dr. Akintoyeshi. And I want to appreciate our viewers for staying tuned. When we are talking about trauma and substance abuse, trauma, like I said earlier, could be in any form. Could be emotional trauma, could be sexual assault, could be a loss of loved ones. If the individual does not get over these traumatic events, in search for strengths, the individual can end up using substance, especially the young one that is being bullied every now and then. You want to have his strength back, you want to have his confidence back. Somebody can just introduce something to him or her, and it takes once, it felt, oh, this is me. Yes, I cannot stand to, to give feedback to whoever. From there, the individual may get addicted. Remember, the first stage of use, no intention to become addicted. So trauma comes sometimes with addiction. Thank you.
Thank you so very much for that quick response to that. There are lots of questions here, comments, we can see them, and we appreciate them for coming. Somebody said, how do they deal with the shame and stigma following addiction? And I think that is what Ms. Agbola talked about some few minutes ago, that they can't find acceptance. Family support is important. Yes, they had fallen from the chart, and we must not make it look like they had fallen forever. So it's important that we are able to do with all of that for them, because otherwise they would not be able to move on. Dr. Koyejo, at what age should substance abuse prevention education start? At what age should it start?
Thank you very much, Dr. Akintoyeshi. Well, research has shown that from people from in primary 4, that's how what age? Primary 4 students should be like age 8 years. That is when this substance use prevention education should start. And may I tell our audience that substance use prevention education is not showing children substance. That is suggestibility. It's teaching them those things I've said: decision-making skills, stress management, coping skills, communication skills, social skills. Those are a substance use prevention education, not showing children, don't use this, don't use this, don't use this. By the time you do that, you are suggesting to them, and that's very dangerous. Thank you very much, Dr. Akintoyeshi.
Thank you so very much. I have quite a lot coming in. Hope I'm able to. JSB said, thank you for this wonderful presentation. God bless Yaba Voice and the wonderful resource person of this great job. Drug abuse and addiction is indeed a pandemic, especially in Nigeria. People use drugs to cope with the current hardship and are punished when organizations like the NDLA catches them. Please, is there a way the government and relevant organization can be made to see addiction as a pandemic and the approach of intervention giving full attention like we did during COVID? Ms. Agbola, what's your take on that?
If you actually listen to Dr. Koyejo, she has said a whole lot about that. What is the government policy about use? When it is not available, there won't be anything to purchase. Once this is available and people suffering, unemployment, an opportunity comes for them to find themselves, on any form of substance, they take advantage of that. So the policies we are making goes a long way when we are talking about addiction, and when they are being caught, they are being punished. What is the stake of government in the availability of these substances? It is so much available that you see children going around to get it, even in the open. Like our moderator said, Dr. Akintoyeshi, you say you saw a woman giving a 3-year-old boy beer to drink because it was available. And the woman, the mother, without understanding of the implication, when such a child gets older, what do you think he or she will be doing? So our law enforcement agencies should please go more into the society to see that the availability of substance is being curbed. Thank you.
Thank you, Dr. Koyejo. Now, another question here, a quick one, is that this person had been to 2 rehabilitation centers, yes, is still using. What can we do for this person? 2 rehabilitations, yet is still using. What can we do to help this person? Quickly, ma'am.
Thank you very much. From the definition, addiction is a chronic relapsing illness. It's a long term, it keeps reoccurring, like diabetes, like hypertension, which are chronic illnesses. So sometimes you don't measure success by total abstinence. Is there improvement? And once there's improvement at every stage, then we'll keep up with the treatment. And sometimes lapse does not mean relapse. So for somebody that has gone to 2 rehabilitation centers, how well is this person doing the follow-up treatment? It is not an event, it's a lifelong thing. This person that has been discharged, how is this person adhering to post-discharge, or how well is this person adhering to treatment? Sometimes all you need is to keep seeing your psychologist. Psychologists are specially trained to help you bring the strength out of you. So you don't say, I just go there, all they do is talk to me. That talk is expensive. That talk is changing, it's mind changing, and you must appreciate that. So we don't measure, so lapse is not a relapse, and it is not, abstinence cannot be used to measure success. And how well is this person adhering to treatment, adhering to follow-up services? And that's the way to go. So it is a chronic relapsing illness. I hope I've answered that question, Dr.
Yes,
Akintoye.
thank you. You have answered that question. So if this individual is still doing well after discharge, how is he doing? How long was he able to sustain itself? Lapse or relapse is common when we talk about substance. So you may not have them totally drug-free, but we know that they can always get the help. Mrs. Maureen Katie, now a child was discovered using substance, the child has stopped. Do they still need to get help for that person? Quickly, ma'am. This child is no longer using. The parents just discovered. Do they still need to bring the person to the hospital? Moot.
You don't say because the individual is no longer using, you won't bring him or her back to the hospital. And that was one of the points Dr. Kwejo just mentioned. Is the person adhering to follow-up? Follow-up is as important as the treatment from day one. So don't say because it's no longer used, let's leave him. Each time it comes to see the doctors and the nurses, the psychologists, social workers, there are one new thing or the other that he or she going to get that will remain part of the strength that is going to, live with as part of recovery strength. So it is very, very important to still bring the person back for follow-up. Thank you.
Thank you so very much. Double High says the government can invest educational awareness programs in school, higher institution, and within the community. How do you help someone who doesn't want his parent or guardian to know he's using an addiction, yet he or she keeps relapsing based on the support system? You may not be able to help if you don't get the person into the system, into getting the help that they need. So it's important that you need to bring them in. However way you want to do that, then they need to also understand that they can get the best of help. Now, if they don't get help, they will keep relapsing, they keep getting worse, and eventually their parents will know, their guardian will know. So it's important. When a child is resisting, then find a way to get the child in. They will always know how to get them, how to talk them into it. So get a way to get this individual to come in for testing. Thank you so much. Please, can a trained or professional counselor help in supporting substance addiction? Professional counselor, maybe you would have to undergo certain level of training, specifically on substance addiction, to be able to help totally in that, because there are specified form of trainings that people like this, that we have our experts that they had undergone. Thank you so very much. I did dot so Jiboye, yes, to the psychiatric hospital. Thank you so very much. Thank you to everyone. We can't take every comment. But what can be done if a child resists screening? And that I've answered that. I said, please find a way to get the child into. We always know a way to get them into. So find a way to get them in, to come in for treatment. And then that way intervention can start. If you don't get them in, things can de-escalate, and then it creates more problem for you. So thank you so very much, everyone, for being on this call. I love the comments about the 1 hour well spent. Thank you. You have just made our day, and you have made the effort worth it. So thank you, everyone, for being on this call with us. One last word from our speakers. One last word, Dr. Koyejo. One last.
Okay. We get thanks to our moderator again and our audience. They've been here for like 1 hour. Well, I'll tell the audience that it's not just about the government. All hands must be on deck to help our children and the community to reduce this prevalence. It is your work. It is my work, not just the government. Thank you very much.
So very much, Mrs. Agbola.
Thank you very much. At this point, I'll be leaving our listener to the fact that addiction is real and nobody planned to be addicted. So we have to be each other's keeper. Check on your children at home, in school, check on your husband, check on your relatives, wherever. And if you suspect anything, please seek for help on time. Thank you.
Thank you so very much. This is everybody's responsibility. We need to rise up and deal with this problem. Otherwise, we'll all be caught in the wave of it. Because as you know, it's no longer in the tertiary institution again. It's also in the secondary school. And before we know it, we start talking about it in the primary school, if it's not even there already. So everyone needs to come about. Timely intervention is key. Yes, mine still to go, but thank you for your numerous contributions to this conversation today. I had seen all that you had said. And please note that when we're talking about addiction and recovery, it's a lifelong journey. And then we all need to support them to be able to get them to the place that, oh, somebody said it's already in the primary school. So that's why we need to be more proactive with what we're doing. Preach it in your church, preach it in your family, in the mosque, everywhere in the community. Be the vanguard, be the voice. Like we are doing in Yaba, we may not be able to go everywhere, but we can always just do our best. And our best may not be enough if we do not have people who will echo it round to the world. So thank you so much, everyone, for being on this call with us again. Until we come your way again next month, by the grace of God, the third Thursday in the month of July, we'll be looking at mental health challenges of the elderly, and we'll be looking at the causes and solutions, mental health challenges of the elderly. And please note that recordings of this present webinar is found on our YouTube page. So you can get it on our YouTube page, as well as recordings of the past episodes of the Yaba Voice webinar. So you can always just get those recordings and listen to them over and over. And then you can also share and subscribe. That way it gives us good visibility so that everybody can get to see and can listen. So until we come your way again next month, by the grace of God, keep flourishing. We appreciate our speakers. So on behalf of the medical director, Dr. Olubenga Dekile, as well as Dr. Stephen Oluwani, and every member of the Yaba Voice team, please stay safe and take care of your mental health. The Yaba Voice page, YouTube page is Yaba Voice, one word, Yaba Voice FMPHY. Yaba Voice FMPHY. Thank you. You can access our recordings as well as the past recordings there. Bye-bye.